global mental health advocacy and visiting professor at the Population Mental Health, Nova University in Lisbon, Portugal. He was past president of the World Federation for Mental Health, and this is amazing. It's the oldest mental health advocacy organization in the world, and it's true. It's done incredible work around mental health and does the October 10th campaign for Global World Health Day, Global World Mental Health Day. He was awarded an MBE, which is Member of the Order of the British Empire by Her Majesty and the Queen. He's an International Distinguished Fellow at the American Psychiatric Association and chair of the APA Caucus on Global Mental Health, a Wonca, which is the World Organization of Family Doctors Fellow, and a member of the American College of Psychiatrists. Professor Ivbijaro is a specialist in integrated care and primary care mental health. So bringing that together, he is the editor of the Companion to Primary Care Mental Health, an international collaboration of 110 global authors aiming to promote access and delivery of evidence-based practice in primary care, which is so critical to happen. To have happen to reach people that need mental health care. And he's the founder and chair of the World Dignity Project, which is a charity dedicated to promoting dignity in mental health, which is so very important. So we are so grateful to have him here with us today.
Yeah, Kathleen, thank you very much for this excellent introduction. I couldn't recognize myself with that fine introduction. But let me start by actually thanking the organization for this event, Happiness Agora event 2019. For me, it's a pleasure to participate, and I want to thank all the previous speakers who have spoken a lot about what the issues we are dealing with, and all the global participants, because without the participants, there's no show. So I want to thank them very much. I'm a family doctor, also a trained psychiatrist, so I work with service users every day, and they inspire us. So I want to thank the patients, their families and carers for actually sharing with us their vision of what they think the future should look like. Many of you are great advocates. You do a lot of work, and without the advocacy, we'll be nowhere. For me, I'm going to be saying many stories by many people, and many people have contributed to this. So I'm going to thank members of the World Dignity Project for actually allowing me to dream and to allow some of my dreams to come true. I started my passion for mental health and dignity mental health when I was actually a senior house officer in Nigeria, when I was in a teaching hospital. I realized at the time that many people with mental illness were treated very badly. And I thought, psychiatrists alone couldn't do it. So I actually began to think that there must be a way out of this. So, and since then, I've been lucky to travel around many countries of the world. And the stories they've been telling us have been the same. That people, once you have a mental illness, you are treated badly, you don't get what the care you need. And so I was actually convinced that not being a doctor is not the answer, but being an advocate. So I've spent most of my later lives being a mental health advocate. And I want to thank the WFMH, the World Federation for Mental Health, who actually agreed to actually have the 2015 World Mental Health Day on dignity in mental health. Why is this important? I will tell you a quick story. I was in Lille in 2015, and at the time we were talking about mental health and dignity in mental health. I was shocked and surprised that many professionals did not think it was an issue worthwhile to pursue, but patients, carers thought it was something we should do. And I was glad that the WFMH and the WHO supported this. And since then, we now talk about dignity in mental health. It doesn't matter if we don't define it, because the question was, there are many definitions. But if your dignity is violated, you know it. If you are valued and your dignity is enhanced, you know it. So let me look at it from what the patients are telling us. So this slide I'm showing you right now was one of the work that we did together. So, and I want to thank Claire Brooks, who actually, managed this research on our behalf. And we spoke about this in Lille in 2015. We were concerned at the time that people found it difficult to define what is dignity in mental health. And there was issue as to what are you using dictionary definition of what. So we spoke to the people, we spoke to families and patients, and what did it mean like? And what they told us was that it was a journey of hope, a journey that takes us from the beginning to a system where everybody feels it belongs to them. So if you concentrate yourself on the middle part of the slide, you see the patient starts, say, we want to have hope. It's all right to be ill, but I'm a journey for recovery. In the middle, you have a system, what I call the government and professionals, doing the right thing to help you and help us in this journey. And then what happens? The individual feels embraced and loved. And that's when you take these three components, that is what it is from patient's perspective to be in dignity in mental health. And really, so if we begin to take these components in our day-to-day practice, then we begin to understand what it feels like and what patients feel like. Why is this important to have dignity in mental health? So when you think, that when you look at the literature, it tells you people with mental illness die 15, 30 years before their time. Why should that be so? If it was in other conditions, by now people will riot. It tells you there's health system failure all the time for patients. Many countries, even good countries with high insurance, don't cover enough of mental health. If you're unlucky to have physical health problems, which will happen anyway, you have poor access to your physical health care. We know, we've proven that integrated care works, in the work I did with WHO in 2008, but yet, for people with mental illness and mental health conditions, they don't get that. Policies don't drive the change that we need. So when you have all this together, why is this the case? And we think, looking at the literature and speaking to people, that is the stigma, mental health stigma, that drives these inefficiencies and poor access to health that people get. And the consequence of that, what is it? It leads to less funding. So people don't have enough funding for treatment. There's not enough funding for research. Because there's no funding for research, people get less evidence-based practice. What happens? People becomes less visible. You are not part of the system. And so you have a system where the policies fail you, the funding fail you, and of course, you have these consequences to our health. So let me run through something for you to understand this a bit better. So on patients, we know this, family, we know this, and doctors and professionals, we know this. If a doctor in a hospital misses a diagnosis of breast cancer, his colleagues will report him to the authority, he'll probably be sanctioned. The same doctor sees somebody with respiratory problem, what will he do? He will investigate. He will try to find out what the issues are, because he does not want to miss a serious issue or cancer because he doesn't want to have problems. The same doctor in the same clinic sees a patient or an individual with emotional distress. He writes very little or nothing in the case note. He does not investigate. Why? Because he doesn't think anything will happen. So really, what I've given you three scenarios, one about cancer, one about respiratory, and one about mental illness and mental health. You will have noticed for those two conditions, people felt, an individual will feel that their dignity will be enhanced. But for mental illness, you are robbed of your dignity. You are not even the records are not even clear about what you have done. And let's pursue this a bit further. What we know in the general public from data, this is hard research, tells you that when you take women of all ages, and you compare those with mental illness, those without mental illness, you will notice that referral for mammogram for women, if you have mental illness, you are less likely to refer for mammogram when it's indicated. If you are in diabetic crisis in hospital, at home, you are less likely to be admitted to hospital. If you have a heart attack, you are less likely to have cardiac catheterization that we know is effective. And even if they offer you treatment, you are not offered a choice. And then that's in terms of health. In terms of social, what happens? Many people with mental illness are likely to be employed, and their earnings are reduced by at least 25%, if not more, when you take them in total. So you have a system that stops you from earning good money. It stops you from getting the health care you need. And in addition, you are dying early. So why should that be the case? It shouldn't be the case. So we need to begin to think of a different way, and we need to be taking into account what the patients, the individuals are telling us about their conditions and what we should be doing. So again, as part of the World Dignity Project, we decided to actually say, let's stop thinking about dignity violation. Let's begin to think about dignity enhancement. So we commissioned another research. We want to hear what the service users are saying. So this was an online research, carried out again by the model people on our behalf. And there were 6 good questions about diagnosis, about what it feels like to have your dignity enhanced. And people were allowed to choose videos or photographs to actually explain what it feels like. Because I started earlier on by telling you about lack of dignity, but we are interested in dignity enhancement. So really, so we thought that we should move this forward to that field. And what does it feel like if you have your dignity enhanced? So I'm going to, in the next series of slides, I'm going to be telling you what patients have said. So these are individual stories, but they represent the collective of what the people are telling us. The good thing about this research is that we covered nearly all the continents. We covered all the continents of the world from 78 countries, from 21 countries with 78 patients. I was amazed, that the stories from each of the country, each of the participants was very similar. So really, it doesn't matter whether you're from Africa, China, Asia, USA, people that participated in this research, they tell us the same thing. They tell us the same story, that they want to be valued. They want to be part of the system. They want to contribute to what it is that we're talking about. And so let me tell you some of the things they told us. For example, this question was about what makes for a positive patient experience. This patient from USA says, I want to be in a safe place. I want to feel safe. Even when she was very distressed, feeling suicidal, she thought and she felt that the fact that she was provided a safe environment supported by caring practitioners was a game changer for her. And she chose this image of actually a beautiful hand, 2 beautiful hands, 1 bigger hand and a smaller hand supporting each other. That's what it is. That is what dignity mental health felt like to her. She felt that she was valued. She felt that she was in a safe place, and therefore it supported her healing. You remember earlier on, I told you about the journey of hope. She was provided hope that she could recover, and she did recover. These other patients, that we spoke about, say, what is it for you? What is it that makes you feel that your dignity is enhanced? And she said, I want my feelings to be validated. And think about yourselves. Think about each and every one of us. That is correct. That at home, if you have a mental illness, people are afraid to express their feeling. They are afraid to express their feeling to their doctors. They are afraid to express their feeling in society because people will frown. But no, they want their feelings to be validated. Tell me, I understand what you are going through. Tell me, I am distressed and I'm here to help. Simple words, simple things. They are not expensive, but because often we work like machines, we begin to forget that the people are dealing with are humans, and therefore we needed to do something differently. I actually like this, that I want to feel safe, So this, it doesn't matter whether it's with mental illness, in all other conditions, you want to feel safe. And this was a patient that says from Portugal. Many of you must have been to a doctor before, you know what it is. When you start talking, even before you start talking, they've already cut you off. You want to express yourself, they interrupt. So again, our patients are telling us that they want, when they go and see their doctor, they want to be able to talk. They want to be able to speak without being interrupted so that at least they can express themselves. You've taken the time to come to a place you feel is a place of safety. Why can't you talk? So again, very simple, but it was the same again across many of the people that spoke and the images they showed. So they want you to speak to them in a non-judgmental way. Try to understand where they're coming from. Even when you don't understand enough of it, listen, be there, and don't interrupt. If you have been unlucky, to be detained under the Mental Health Act or under the judicial system, you can understand this better. People, they take control away from you. Why should they take away control from us? And so they want to be able to be involved in the decision making, want to be part of that decision, want to contribute. They want to be a partner. So the question, what he's saying here is very simple, that we are partners, whether I'm a patient, a carer, the doctor. It's a partnership approach where I'm allowed to take control for myself, and you can help me move this forward. And then, so this patient from Uganda, I know we've chosen this one from Uganda, it could have been anywhere else in the world. It will be the same, that I want to be involved in the decision making. There's nothing wrong with that. It's actually appropriate. We should continue to fight for that. People want to be given the appropriate tools, you know, to do the right thing. And that's very important. So a few minutes ago, Graham spoke about the patient that he had been managing who did not want medication, but wanted psychological therapy. What is wrong with that? You know, why are we not giving people tools and the equipment for them to move forward, to look after themselves? We know that exercise is good for people. Why we don't recommend exercise? Why must we always say you must take medication? So that's something that, again, allow you to think about your dignity, allow you to feel that you are part of the decision-making process, and allows you to feel that actually you took the decision. So to have your dignity enhanced, you have to allow people to be part of the decision-making process. This slide actually is very beautiful for me because it talks about hope, you know, because I think without hope, you know, nothing is possible. And for too often, when you look at, you know, the publications in mental illness, it tells you it's chronic, it tells you untreatable. No, they are not untreatable. We are on a journey and we must give people hope. So this young lady from Sweden, with physical health problem, she said, I wanted hope. And that was what was given to me. And that is what made me recover. That was part of my journey. So, and I think we should actually talk more about hope. You know, because when you go to hospital, if you talk about hope, people think you are stupid. You know, you are not, you know. I want to be given hope. I want to have the hope that I'm on a journey of recovery, and I'm on a recovery pathway. And really, in my job as a family doctor, that's one of the things we do, that we see people at all stages of their mental illness and other illnesses. So we're there to provide them hope. We're there to support them in this journey and to show empathy and to give them tools for their success in their journey. People want to be communicated with in a thorough way. So don't give people half information because you think they won't understand. You know, spend time. And nowadays, you know, you can use emails, you can send text messages. In my clinic now, I write letters to patients, after the clinic appointment, I send them a personal note if I think it's something I want to highlight, and I allow them to write back to me. You know, many patients do write back to me, and we keep a dialogue going. And I think, this is one of the reasons why I've been marginally successful in my clinical practice. I was a young lady I met some time ago who dropped out from university, and we met, we had good discussion, and I kept on writing back to her every time she came to wish her well, and that she was making positive steps. About 2 weeks ago, she came to tell me, A, she's got herself a flat, B, she wants to go back to finish her course. I was very excited. And what I did was nothing magical, except that I respected her. I kept in touch with her. We communicated by letters. She brought letters to me, and she came to tell me the good news. And I was very, very pleased. So really, something that we had a shared vision that it was possible for her to recover, and the recovery was not impossible for her, and that we could work on it together. So this slide puts together in a lot of ways, because this was a slide that a young patient from London actually put it together for us. And she said, what does it feel like for dignity in mental health to happen? She said, one, you want to be held, you want to be supported. So that's the first thing. You want to be able to talk to people, you want to be able to communicate, you want to be given opportunity to participate in society, you want to be loved. She's looking for a world with no stigma, and that the government has a role. So the government should legislate appropriately to support people, and so that they don't feel that they are nothing. If she wants to be part of a family, why not? Why can't she be part of a family? In many parts of the world, see, if you have a mental illness, you can't find a husband or a wife. Why should that be the case? Yet we know that nobody's immune to mental illness. So she was talking about a world of acceptance, a global system where we can speak, where we can be proud to say, I am ill, but there's nothing wrong. Where we be proud to say, I am different, but there's nothing wrong. To say that I'm on a recovery journey, there's nothing wrong. That's a beautiful statement from a young girl. I think she was about 17 when she wrote this. It's a lot of lessons for her to learn that often Because we spend too much time among ourselves, we forget that we're dealing with people, we're dealing with humans, and that we are there to make a change in people's lives. So, so as part of this, I'm spending more and more in the public arena, more and more saying, actually, we could make a difference. So we, as part of the World Degree Project, began to look for ambassadors, people who will speak for us. Because I think, because people are embarrassed or ashamed to talk about mental illness, often people don't come out, therefore we don't fight the true cause. But if we get ambassadors who will speak for us, who ourselves, we probably will make a difference. If you think, you have many symbols for many illnesses, the HIV, breast cancer, but there's not a single unified symbol for mental illness and mental distress. So we worked with young people, elderly people, service users to think about what can we have as a beautiful image to show this illness and journey of hope. And they came up with the dignity symbol, which you can see on this slide. And it was, I went to Chicago where I showed these social young people. And what did they say? They say they love it, very beautiful. If you think about it, it's an umbrella is a shelter, isn't it? That shelters us when it's raining. The heart, to show that we are human. And what is thinking that you need to bring the umbrella, the shelter, and the heart together so that we can feel that we are the same. There's no difference. The body and the brain and the heart are the same. And really, this is very, very important for us. So we are looking for global ambassadors all over the world to come to join us to say, actually, I want to make visibility for mental health, and it's nothing you should be ashamed of. And really, I'm sharing these 3 hashtags with you, and I want you to use them to talk about the dignity of experience. I want to have a good experience when I go and see my doctor. I want to have a good experience when I go to the post office. I want to have a good experience when I'm on the person. I want to be proud that, yes, I have an illness, but I have hope that, yes, I'm on a recovery journey. I want my family to be looked after, and I want them to be able to say, yes, I can get married even if I have a mental illness. And I think this is what this is about. This is what this World Happiness Agora is about. We should be happy for what we have. We should be happy that, we have an illness with hope. We should be happy that our doctors can look after us. And more importantly, we have a family. Mental health, mental illness is a global family, and I belong to a global family. When I go to Geneva for a WHO meeting, I meet lots of friends, and I see them as members of my family. I meet Catherine and everybody. And in Malta, we just came back, for a meeting in Malta. Again, we felt the same. I think for too long, we have been hiding. We don't need to hide any longer. We need to come out to say, actually, there's nothing wrong. If you look at the statistics, 1 in 1 person will know somebody with a mental illness. That means you cannot say you don't know anybody. And 1 in 4 of us will have a mental illness. So therefore, a quarter of the population. Something that affects a quarter of the population, something that we will know about, why should we not talk about it? So really, I want us to think differently. For me, it's a message of hope that mental illness is not a taboo. It's no longer a taboo. Let's speak about it. I am glad that I started this journey many years ago. I see a long way to go, but I know together we can truly make a difference. Thank you for listening to me.
Oh, and thank you so much, Gabby. That was wonderful. Yeah, I think bringing dignity to mental health is so important because there's been so many human rights abuses that kind of astounded me when I started in the work and in the field, just what was really going on that wasn't being reported on. So bringing dignity to mental health is so important. And I find it fascinating that, with the work in your survey that, these people, they just want to feel supported, and valued and loved. And that's, definitely it's a basic human need. And we all deserve to feel that way, really, and should, and respected within healthcare. So yeah, the work you're doing is incredible. And you have you can sign the declaration. Is that still correct? Can you? Okay.
We want more people to sign. because we want to be able to take this to the WHO and the United Nations to say, actually, we want our voice to be heard. We want to be part of the system. We want funding for health. We want funding for research. We want good housing. We want policies, you know? So really, I'll be very grateful for more people to sign. The more, the merrier.
Wonderful. All right, good. We'll put that link in there. So if you want to bring more dignity to mental health and you believe it's necessary, which I hope you do, and if you care about happiness, I would think that you probably do, you can sign that for the World Dignity Project. And thank you so much for your leadership and work in the space. And you've been a great mentor to me. And I've just loved getting to know you and all of your work. So thank you so much.